Bem-vindo a todos os participantes por parte do IE.
Welcome to all participants on this QAM, which is medical team, for the second day of this symposium. My name is Dr. Maria-Helen Urs. I'll moderate this section and I'll focus more on the stigma and other issues. So in the context of the guarantee of this key intervention, to invest in the following of women and young ladies that have been affected. So the reason why within this section, we're going to have more participants that are going to talk about their discovery and the situation, and where we have to follow other women with that in the same platform. So for when it comes to stigma, is something that is not inevitable. I've got an interested list of moderators for this section that would like to talk about this topic, that participate in a section. So we have to have an opportunity to have questions for them, but they will be part of this. We hope that this program will be of the benefit for all of you. Now we gonna talk about the housekeeping rules so that we can follow everyone. All the participants are deactivated, are mute. There's a possibility of interpretation from English to Portuguese and vice versa. It depends whoever wants to follow. Please select your language of preference and then so they can follow all the discussions. So we invite everybody all to introduce themselves and clicking on chat, which is at the bottom of your screen. You'll see the message that will appear in chat box for some interaction. Please, you can include your first name, your surname, your organization in which, and the country that you represent. So you can also use this opportunity to connect and we meet each other. If you have any technical problem and if you can't see any chat box, for instance, try to change the internet. Use same chat box for question and answer section that will be done at the end. And we also invited to send your messages as an active participant of this event, ASA for Education of Mozambique. You got an opportunity to receive a registration. This affiliation fee, affiliation register is valid for a year. So it will be part of this symposium. So click on inquiry that will show you a special. So you are already a member. So the affiliation automatically will be activated. So now I've got a pleasure to introduce to you our first panelist. Good afternoon. Now we're going to show the inquiry so that you can participate more, and we need to know more how do you feel in this section. While we wait, while you guys answer the inquiry, I will have to wait a bit until I give you the result of this inquiry.
Já está a chegar, só pouco de paciência.
Please just bear with me. The results are coming through.
Então, o inquérito é aberto. Vamos partilhar.
The survey is open. Let's share the results. We can share the results while we wait. We can start. We can thank you for participating, for your poll. Once we got the result. Now we can go to the first presentation. Please just bear with us, waiting for the result of this poll.
Ok, então agora já está.
Okay, well, now we set, now we can go ahead where we can be able to introduce the first participant and we can share the results that are really interesting. I've got the pleasure to introduce to you Dr. Gisela Zambuza. She is the head of Department of Public Sector. Dr. Zambu, she has got a degree in medicine in 1996. She works in the Gaza province and she is a medical journalist before she finished her specialty in 2009. At that time, she had an experience in a clinic way and with leading with TB patients, children in the hospital, and more. And after that, Dr. Zambuza, she worked as a director of Department of Pediatric in Mavalani Hospital, and then for intensive care units, and then in Maputo Central Hospital, 2010 to 2015. So during that time, she coordinated the care of health promotion, and then for within the primary care, and she also worked in control where in the strategic health department for prenatal care, and she also worked for other care health for emergency, pre-care for the initiation phase, and also the way of administration way. Dr. Zambuza, she will present which is called National Policy for Vertical for my mother and daughter on HIV. Dr. Zambuza, the platform is yours. Thank you. Muito bom dia. Good morning, all the participants in this symposium, which is virtual, which will talk about the science, community involvement of youth in an answer for integrated HIV in Mozambique. My name is Gisela Zambuza. I'm a medical doctor, I'm a pediatric, I'm a head of the Department of Women's Health and Children in Ministry of Health in Mozambique. I'll start by thanking the invitation to participate in this symposium, which is very important for our country, and to share what are my experience in Mozambique in the program of prevention of transmission of HIV. As we know, it's in the pandemic, as a pandemic, we got something that we can do. And this progress and the challenge in this area. Theme, which I'll talk about, in national politics for PTV in Mozambique. The contest, I'll do a small introduction and conceptualization. I'll talk about the TARF, Universal TARF, the program of transmission in Mozambique. I'll start by saying that Mozambique is a country located in Southern Africa with a population of about 29 million, according to the 2017 census. So here we're in the phase of transition for about 30 million inhabitants, in which the urban population is 32%, and the youth is about from 10 to 24 at 30%. We got at the fertility tax rate of 5.3 for women, which one 3.6 in the urban area. And the prevalence rate, the anti-conception is 25.3%. Our institutional labor, our births in 2015 were 70.3. According to IMACID, it was a survey for malaria HIV, which was done in 2015. And at this present moment, according to our statistic from National Department of Public Health, in my department, we are on 87%. The mortality ratio is about 551 by 100 of birth, when which, when we talk about the death, direct, the frequent bleeding, other disease, and hypertension. The other direct involvement, we got HIV, which is about 19% of those deaths. So the prevalence of HIV in general population is about 13.2% according to IMACIDA. So in our country, we got 3 regions: North, Center, and South. So not everybody got access to those primary care. So what is the involvement of the history involvement of TPV, of the prevention in the country? In 2004, we had a program, the national program of PTV, and in 2011, Mozambique endorsed a global plan to eliminate the transmission, vertical transmission of HIV. It was after that, after national plan of this HIV transmission from 2012, from 2012 until 2015. 2013, it was universal for the inhabitants who was needed. In 2015, we had a survey, an inquiry about malaria, HIV, to see what was the situation of the pandemic, not only on HIV as well as malaria. In 2016, we started with our testing area, which could see that any HIV positive person can start with universal health. In 2018, we had accelerated plan to ETV on HIV and syphilis. Sorry, she's breaking. From 2018 to 2020. In 20, we have there to the plan of triple elimination of TB, HIV, syphilis, and hepatitis B. Sorry, the presenter's line is breaking. According to the orientation of the organization of WHO, what we have the strategy. The strategy says stay free, AIDS free. So we got a global orientation and criteria to process of validation. We have to eliminate the transmission from mother to daughter to children with the HIV, syphilis. That was a plan from WHO. We had a global sector which we included HIV, ETS, hepatitis, viral, and 2016-2021. We also had national plan which prioritized several sector in Mozambique. We also had another national strategic plan, which is PN 45, which 2021-2024. This plan, the prevention of control of ETS from 2018-2021. When it's called the strategic plan, we have to reduce. One of them is to reduce the rate of transmission of HIV to 5%, which will be more or less 750 cases by 100,000 birth, and we have to also case of syphilis congenia from 750 for 100,000 prenatus. And have to also do it, everything is enquadred in a triple elimination of safe HIV and hepatitis B, which, which will go from 2020 to 2024. And recently, PTV put it with a free model, which is divided in three pillars, which are in which one of the studies is a consultation pre-net, and for women, a pregnant woman, a partner, we also give, which is universal. We also intervention at the sound and the retention of those women during the treatment. We do a monetary and pre-exposition, which are to the couples. And in maternity wards, we also have a free ATS, which will be counseling and tests. So in maternity, you can be able to have to be tested, and we also have an option, which is staff universal. We can also supply the retroviral for the child. In a consultation and counseling of the child for healthy women and their partners, we also have an option, plus the intervention for the adherence of the retention, monitoring of viral. We also have a PrEP, we have a proposition preferency. Everything is done in only one platform, which will do this package in relation to the prevention, which is a vertical transmission. We also link it to the community which are HIV. So the adults, they are women that they're going to experience when in the HIV period, which have been affected vertical with a child, which they actively they link and they improve for our consultation, and also they visit preventive, and also the integration visit for those who left the treatment in the community, within the community. Where do we are? Where are we positioning UTID? Unless if you know that you're HIV and consultation in 2016, we had about 87% of women, they knew the state. And throughout the years, 2017, sorry, 2021, we've seen this rate increasing in going about 99%, 2017, 97, 98.18. For the first semester, six months of 2021, we were 99% of women that they knew their status when they went to CPM. For women which have been registered on a pre-consultations, the prevalence, the possibility is from 8% in 2017. It was the first 6 months of 2021, and now we are at 7% of women which are positive and that on a pre-consultation. In terms of cascade of PTV for the services, which you go in the CPM, where a pregnant woman, where she goes first, the one who's been exposed to the HIV, and the first semester of 2021, we had 58,883 women which are HIV positive. HIV positive is the one in which 98% of these women were in intervention, taking any medication to minimize the transmission from mother to child. And those women which are on CPM, we have about 98% when they came for the first consultation, and about 87% of those children which have been exposed on CCR, they are being controlled. The children for those positive women, they are involved, they're placed on a risk child, and 86% of those children which are exposed, they got first PCR and Daniel less than 2 months. So it's written that child go through the treatment, and the first 4 to 8 weeks they'll be involved in this PCR to be diagnosed being a child who has been exposed to HIV. What is CCR cascade on the first 6 months? When we evaluate in the monitoring, we got our 9 months program when from start, from first day, and we had children, or about 48,099 children, which are registered on the CCR. And 9 months later, we have children, 86% of the same children, that PCR from the 9 months as a final test, and in which 4% the PCR, they received PCR with less than 2 months, and 815 of those children which were registered 9 months ago, 815, they had their PCR result. In relation to 18-month cut, just in which 445,000, which are registered, 86% they got the result, and 5% as a result when the final diagnostic, 5%, 2,047 were infected with HIV. Our challenge is all the child they are born on a negative from a positive mother. We can see in this graphic the impact of the transmission throughout the years. As I said, in 2004, we started with the program, and 2006, 5 and 7, we had high level of transmission. And throughout those years, we are reducing. As I explained, we've done some intervention, including global plans of the country, which is to reduce treatment. And in 2013, we had that. And as a result, in 2021, we had about 12% of transmission of HIV at the moment. Our target is 2025, will drop to 10%. So throughout the years, we had improvement of the situation, and for universal transmission of the HIV, which is vertical from mother to child. We can see here in 2021, we are at 12%. 2005, it was 43%. We had no access, we had no all the care, and all the intervention we have at the moment that we have, they were still high. Okay. Now we got our challenges. After all the investment which has been done in the ministry in that area, one of the challenges, the woman that is start TARF during the pregnancy, they're high risk. The woman that they start TARF, they got a high level of abandon. So in this, we got orientation of first 3 months due to reason that the 3 months is not enough, because at least 1/3 of this as a patient, we got a lack of monitoring for most of women. most of the women, because we are still away from 90%. The lack of adherence or third women that they live with HIV, a result is also on a level of viral pressure. New evidence of the risk of high transmission of HIV from mother to child after after the birth. That means that we have to train, we have to have tests available, and also have a possibility the retention of the woman. Thank you very much for your attention. That's all I wanted to present and bring as experience for this country for the prevention of the transmission, of the vertical transmission. Thank you. I think now it's time for Q&A.
Muito obrigada, doutora Gisela.
Thank you very much, Dr. Gisela, for this presentation for the Mozambican side. Now, I think we can go to the next presenter. It'll be Dr. Maria Graça. Dr. Maria Graça Ali, she's a pediatrician. She's got a degree in London School of Medicine of Hygiene. She's got a PhD in health and planning. So she's been working as a senior advisor of this foundation in 2015, and then she's got more than 18 years experience in international health public. She's been working from 2003 and 2005. She was in international with a non-governmental interventions, and she's been collaborating with the Minister of Health in planning, monitoring of the program of the prevention of HIV on the teenagers, including the prevention of other age. Also, to add, she's got a big experience in clinic health for children which are exposed on HIV and the teenagers as well. She's got a big experience in monitoring and health management of programs, pediatric health, and to support the national strategy. And the experience include the assessment, TV, and teenager in the area. Agora, vamos apresentar, se presente in terms of the case which has been done in Cabo Delgado province and Maputo province. Dr. Maria Gracia, the platform is all yours. Thank you. Thank you, everybody. Welcome. Thank you for the opportunity to be part of this symposium. I will present of PTV of province which has been supported by this foundation, and then we're gonna also do and see the cascade that where we can fight to eliminate. The Aurea Foundation is a Mozambican foundation which has been created for the initiative where in Mozambique where it's been promoted by PEPFAR. Collaborate with Minister of Health to design implementation and monitoring of strategy innovation way and gives free health care, integrating the quality to control of HIV, in particularly the HIV, and is based in Mozambique. Dr. Gisela presented right now a PTV program in Mozambique, and we've seen the rate of vertical has been declining. So in 2020, we are 20% and 5% of the children that they're less than 5 years. There is a big availability of province which has been defined by the context of different answers. Here, we all present one of the indicators, key indicators of healthcare, which have been supported by Real Foundation in Maputo, we can see in a year that all the women that received all the HIV tests, all of them, they received the treatment and for a pregnant woman, and the rate is 92%, and the group of women is 93%, and all the children, they've received this the next 2 months of the year.
Apenas 31% das mulheres grávidas. Em Cabo Delgado, em 2017, iniciou o conflito militar e até junho de 2021 foram afetados 9 distritos da província e 41 unidades sanitárias foram encerradas. Temos cerca de 700.000 pessoas internamente deslocadas em Cabo Delgado e também nas províncias vizinhas de Nampula e Niassa. O gráfico mostra os indicadores-chave da cascata DPTV nas unidades sanitárias não afetadas pelo conflito e apoiadas pela Fundação Ariel. Podemos ver como os indicadores têm vindo a melhorar ao longo dos trimestres. Todas as mulheres conhecem os seus estados, 99% receberam TARV, a supressão viral nas grávidas é de 82%, nas latantes de 87%, e as crianças, 89% das crianças recebeu o teste virológico dentro dos primeiros 2 meses de vida. Contudo, a transmissão vertical continua alta, aos 7%, e no último trimestre, 30% das crianças HIV positivas eram demais deslocadas. Maputo, província e Cabo Delgado são um exemplo de 2 províncias com contextos diferentes, que necessitam de intervenções diferenciadas. Temos, portanto, que avaliar a cascata de PTV e ver aonde nós podemos implementar intervenções diferenciadas. A ONU-SIDA analisou em 2020 as novas infecções pediátricas e viu que 43% foram atribuídas às mulheres que não receberam TARV durante a gravidez e a amamentação. 25% foram atribuídas às mulheres que abandonaram o TARV durante a gravidez e a amamentação. 23% foram atribuídas às mulheres infectadas durante a gravidez e a amamentação e 9% a mulheres sem supressão viral. Em Moçambique, tivemos cerca de 17.000 novas crianças em TARV em 2020. E temos que nos perguntar, quando é que as mulheres grávidas e latantes saem dos cuidados? Quais são as fraquezas ao longo da cascata e por quê? Se há diferença entre as províncias e como estas mulheres podem ser integradas dentro da cascata. Fizemos um estudo analítico usando os dados do IMA-SIDA de 2015 e avaliamos o conhecimento das mães sobre o estado de exposição dos seus filhos menor de 2 anos. E observamos que em todo o país, 27% das mães não conheciam o estado de exposição ao HIV das suas crianças. A maior parte destas mães vivia na região norte e na região centro do país. E observamos também que 90% de mulheres não participaram nas decisões familiares, incluindo a decisão de ir ao centro de saúde. Uma das intervenções e estratégias que a Fundação Ariel propôs ao programa de HIV para melhorar o acesso à saúde materno-infantil para as grávidas e latantes foi a integração dos cuidados de HIV nas brigadas móveis em Cabo Delgado. Começamos em 2015, em Moeda, com a integração da testagem de HIV e depois expandimos gradualmente, incluindo as componentes dos cuidados de HIV. Em 2018 e 2019, expandimos para mais 5 distritos. E podemos ver no gráfico que a retenção dos pacientes, incluindo grávidas e latantes, que receberam cuidados nas brigadas móveis, representado pela linha azul, é maior respeito à retenção dos pacientes seguidos nas unidades sanitárias. Achamos muito importante alcançar e engajar os adolescentes e jovens para a prevenção do HIV primária. O projeto Inguissa, financiado pelo governo de Flandres, iniciou a ser implementado em 2020 nos distritos de Matola e Maracuene, em 6 unidades sanitárias, 2 SAs móveis e 10 escolas, e tem o objetivo de promover o acesso ao serviço de saúde sexual e reprodutiva para os adolescentes e jovens através do fortalecimento de serviços de SAs nas unidades sanitárias, a oferta de SAs móvel na comunidade, a formação de professores e alunos em temas de saúde sexual e reprodutiva e através da mobilização e engajamento dos adolescentes e jovens no manejo de serviços de saúde sexual e reprodutiva. Aqui mostro algumas fotos das atividades do projeto Inguissa, através da clínica móvel e nas escolas com os professores e os alunos. Achamos fundamental o engajamento dos jovens e adolescentes vivendo com HIV e, por isso, a Fundação Ariel criou a Associação União à Vida, que é uma organização de jovens vivendo com HIV, cujos membros são jovens formados.
Which the members are youth which has been trained to work in health and the mobilizing of community area of youth and teenager. Coming back to this woman and other, it's implemented the way evidence that shows that to keep the continuity of the health care and viral, it's a challenge for the children. This study shows that 50% of women, pregnant women, that they've been viral or they've kept it during that viral area. So we have to have initiative and have the history of the loneliness, high risk, so that we can have a viral way. Another study which was done in Kenya, South Africa, and Zambia shows that about 53% and the factor that is being shown during the pregnancy or lack of support from member family, stigma, food security, and depression. In Maputo province, we've seen the characteristic of the woman, or about 85% children that have been killed in the last 9 months, and 23 health centers. We have been 38% of this mother, they started, 47% of them, they didn't have a person.
I will ask you to be a little bit slower.
They were left alone. 33%, 5%, they refused to take part of this. And we've seen that this cascade, it's been completed.
And we also that 16% of the children, they are abandoned before they were diagnosed. 50% of these kids, they were abandoned in the first 3 months after registering to these services. One of the strategies that is quite is the strategy of the mentorship, and we started to implement it in Cabo Delgado. It is a kind of strategy that engages, and they were trained in order to help in this aspect. And they were helped through sort of teachings in the health communities. Another essential strategy is the engaging of the male also in order to promote the participation of men and to assure the continuity of the health care. And we started thereof to implement this strategy in the provinces through training of the officials in the health facilities, and also community leaders by promoting dialogue with all the groups in health facilities, in the community, and also the healthcare in the workplaces and professional spaces. In order to answer the necessity or the needs of the pregnant women, those, especially on those who have been displaced, we are helping through a mobile clinic and those with premises. We implement then key activities. Unfortunately, these patients, they terminated then the adherence to health care. One of the strategies in order to respond to the economic aspects of those who are financial destitute is the program of saving and rotative credits. Through this program, we create these groups, especially among those who live with HIV, giving them capacity, skills for them to run their own businesses. That we started in 2017 in Maputo and Cabo Delgado. In 2018, we moved then to other provinces. Lastly, we believe that when we come up with evidences, it's key in order to contribute in interventions in this context. We are therefore carrying out evaluations, especially in the mobile clinic in Cabo Delgado, as I mentioned earlier. We're also carrying out surveys with the international institutions. Finally, we know that in order for us to reach this target and the elimination of HIV in children, we have to come up with contextualized interventions. The strategies should consider that there is a phases in women whereby it will culminate with childbearing. So we ought to teach them the prevention. So by so doing, we minimize then the transmission. We use differentiated models in health aspect. We also engage the community members, the girls, and pregnant women. And we also continue to show the evidence through strategies. I thank you very much for the attention. My apologies, I really didn't switch on to English.
5 minutos para descansar um pouco os olhos e poder focar em outro sítio que não seja o nosso ecrã. Podem descansar e nos encontramos daqui a 5 minutos, 13h48. Obrigada.
Thank you. We can have a break now, then we will retain.
Okay, thank you very much. We just launched the break. So you said you'll be back at 1:48. Well, okay. Well, because actually, if we want to be back on track with the original timing, we should be back at 1:44, meaning less than 1 minute. What do you think, Julia, Lauren? What should we do trying to get back on track?
Should we just connect back at 45?
45? Okay,
Yeah.
great. Let's say 45. You're welcome.
Great.
Thank you. So in 1 minute, we'll be back live to introduce the next speaker.
Putain, mais c'est trop bien cette ambiance là.
So we're 30 seconds before coming back live.
Sur retour live.
10, 5, 4, 3, 2, 1, live.
Muito obrigada, boa tarde. Obrigada, doutora Maria
Thank
Graça.
you. Good afternoon. Thank you, Doctor, with an interesting presentation. I have a pleasure now to introduce the president in Beira. She also was a founding member of this association. Unfortunately, because of the technical issue, she won't be presenting on the screen, but thereafter you will see her presentation. She will talk about the promotion and also her commitment for reduction of stigmatization. The floor is yours. Good afternoon to everybody. My name is Arena Castaneja. I am in the association and I work as a manager there in the association of Musana. It is composed of people who live with HIV, AIDS, and it started in 2005 in a Beira hospital, whereby we used to go there with our kids in order to do checkup, and they were found that they infected with HIV in their bodies. So we were advised to do the follow-up amongst other people. So Mosano's association have to help other people living with HIV, especially the children, just so they may have a health treatment and in future they may be healthy, and also to help these mothers who go for the first time for checkup. And we will also do the follow-up to these women, just so there won't be transmission from mother to child. So out of these 57 members, 9 are men and others are female. Now we have 30 active members. With a partnership, at this time, we work NGO Kwambe from 2005, when we were still working as a group that emerged from pediatric hospital. Regarding implementation now, the promotion we do in the health facilities, also in the community. When we talk about these health centers in Munyava, Mascarenha, also of Nyakonde, all these are health facilities. And also HCB, which means Beira Hospital. So we work in Beira with also communities. So we work in a SAGE sector. We have also officials who attend adolescents. Why that? Because we are well aware that an adolescent, when he goes for HIV test, should he be positive, there is a youth there that will hug this other youth, being the first person to help. And like that, this youth who was found to be positive, he will have a shoulder to lean on. Beside that, we have some other members who help in the prenatal that will make this mother who is about to give birth being infected with HIV. There are youth also carrying out teachings, and also with patients, and also they do one-on-one counseling. In health facilities, we have been carrying out the activities amongst those patients who sometimes miss checkups. We also have done, as Musana, we also try and remember or remind these patients about their day for checkup just so they won't miss. So the mothers who have issues uh, of uh, 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 of uh, uh, of feeding schemes, stuff like that, we make sure that we help them for them to be fed. So their role, it's not only in the health aspect. We also help them with recipes just so they will be nutritious. That we do also in our headquarters. When we had Idai cyclone, it's true that we were really, uh, like, we were disorientated in a way because of this disaster. However, with with the support of NGO, with our association, they came, they strengthened us, they supported us, and also there was a psychological training in our association. Why all that? Because firstly, we were sad, to be honest, we were sad. We didn't know what to do because Idai cyclone destroyed our headquarters and also it destroyed our houses. We were in a situation whereby we didn't know what to do, but with the help of Quam in the association, at least we felt that we had a father. They were present. We were surrounded by people who helped us to lift up our heads again and believe through training and social support that um, doctors came to give us this training. We were able to rise again and say, look, after we have seen this Idai cyclone, what can we do? We then went to the communities in order to evaluate the situation of our brothers who are there, who went through the same disasters. We didn't stop there. We received a visit from Viranculus with a mandate from Aquam, who worked with Quam. They came to donate clothing, and this also helped the association. We we also helped the communities who didn't have clothing. We gave them exercise books, we gave them clothing, we also gave them food. So through this Kwame project. Why? Because most of us in our homes, we didn't have anything. The food was destroyed through this disaster. And we also talking about COVID-19, as this association is working also in communities, in health facilities, also in order to prevent this sickness. We teach the youth, the mothers, with the usage of masks, the washing of hands with soap or ash without needing anything. We help the mothers understand the advantage of leading a health and hygienic life. We, if we are to talk about monthly help, we have had many successes. Why? Because there is where we sensitize, we advise other youth in order to adhere to the treatment and with checkups. Because what we have done, we rescue these youth who abandoned and those who don't adhere also to the checkup just so they may come for treatment. Talking about this youth, in truth, they are there with the other youth. And when we talk about maternity, there is our association there to help this mother, to show them all the packages and all the care that should this mother render to the child, because we know that there are many kind of children, the children who are born with excess weight, and also the premature children who are born. And also we advise the mother the advantage also of optimum breastfeeding, and we teach them how to breastfeed. However, we have had challenges in truth, the restrictions in our activities, as we all know that with these restrictions in communities on account of COVID-19, we have been affected negatively. We cannot carry out entirely with the activities given the pandemic. We also restarted with activities in health facilities. This is a huge challenge because we have noticed that when we focused on COVID-19, we realized that we also have kids who need our attention, especially with kids with less weight. But when we help them with the recipes, we can kind of better some aspects. So this youth club, in this youth club, this is a group of youth, from youth to youth, whereby they can dialogue among themselves regarding their challenges, because it's true that when you are HIV positive, when you are alone, it is heavier for you when you are on your own. However, when you know that you are not alone in this journey, it is kind of a relief knowing that there is somebody who is growing up in adolescence who is facing the same status. So by knowing that you are not alone, that helps. And I need therefore to say that HIV, it cannot be a motive in our life that we can give up. Instead, it's a new beginning. So we cannot be dismayed. What we have to do, however, is to seek means of adhering to treatment according to the instructions without missing in our treatments. We have to take this medication every day at the same time, because the most important that we have is our life. So from 2006, uh, uh, I have been doing antiretroviral treatment. I'm healthy, I have no problem, and I encourage everybody with living with HIV, just so they will adhere to the treatment. Should there be any other information that they need, they can come to our Musana information. We're situated in Mungane in Shuta Road. Thank you very much. Thank you. Thank you. Thank you for your testimony, quite profound. Now, I have the pleasure to introduce to you the manager of HIV program. She has been a member since 2018. She worked in the social sphere and health. She's been introducing many programs that seek to help women and children in health in the area of reproduction, and also in prenatal services. Here in Mozambique, she has been a strong a strong defense or advocate or activist amongst the pregnant women. She also led the pilot project in Sofala. Dr. Tribe has had leading roles and also member of the association. She speaks many languages: English, Creole, Portuguese, French. She will give us the presentation. In her presentation, she focused in the vertical aspects of including girls who are pregnant. From this experience, Doctor will give then what has been her roles. Good afternoon, ladies and gentlemen. It's a pleasure for me to be here in order to present to you aspects regarding youth living with HIV and AIDS. These are the contexts that I'm going to touch. Mozambique is one of the African countries with the HIV prevalence. About 120,000 adolescents live with HIV.
The pregnancy and the infection is a big factor and a risk of mortality of young teenagers, which are 10, 24 years in Mozambique. The prevalence of HIV is more in teenagers, which are about 72%, and 3 times more of the young ones. The disparity, 11% of those of the girls, they are on the 9 years. The level of transmission of women is about 15, 49 years, it's about 13%, and the rate of transmission in young girls and women is not known yet, but we're waiting for UNICEF in cooperation with the Ministry of Health. They are now doing a survey to check the vertical transmission in this group. UNICEF has been contributing for the empowerment of the PTV service for young women and women, most of them living with HIV. So in a way to keep them alive, healthy, and HIV. This care is adhered to treatment, and still a challenge in this group, being that UNICEF have been in a partnership with Africa, which is QAM in Beira province, to solve that problem. The partnership, QAM, UNICEF, in the context, this rate of prevalence is about 8.6, which is superior to the national media. 13% of the positive of these young girls and pregnant women in Beira province. The rate of prevalence in HIV in Beira for young pregnant women, it varies from different ages, as you can see here. Here are the place of the implementation. We are in 7 health centers, which are specific, and the names of these health centers where we're being implemented, and we also implement community level, especially local organization. Kuplu Musana is an organization of women living with HIV, and other partners, local partners, and Nigeria and AGS, which are organization or your usage of the organization. We got a key activity which the project has been focused on to contribute for the retention of this. So in level, community level, we also have integration, those who left and the absent one, and we also the young pregnant woman, and we also sensitize this young through the platform like TV, radio, television, for minimize the stigma of stigma. On the SAGE level, we got education of technical team of 8 people, which to improve this. We also have a capacity of some members of SAGE for new norms, and we have a demonstration of so that we can have nutrition habits, and is an activity which is very important to enhance the nutrition. The district level and provision supervising and the support for this system, weekly collection of samples for this lab. We capacitate in the first use of the system with collecting COB on cell phones. COB collect is a system which collects data for this program, and quarterly meetings that we will discuss this data. Supporting activity, we got groups of psychological, which are individual, manage this case for this person, phone calls for the visits for this. This one is very, very important because it's got to do with the teenager, which go back to Kusham for our clinical services. As such, this helps a lot for these calls. Activity of mental health support and so from QAM, which these activities after the cyclone, EDI, and also the provider for this teenage. There is a lot of trauma which has been caused by this cyclone, and we are in a level where, for those who live with HIV, the mental health, it was more important, so they can pay much attention in these activities. Here, as I said, is the places where the program is being implemented and the type of services that we provide. And here, some pictures to show you different types of activities. Here you can see debates in health centers. We can also see in schools other activities. This section, this presentation is focused on a PTV, on pregnant teenagers, and also the program and the partnership with QAM and also services of SHAM. It gives to young boys, as we know, the situation of HIV is not only affects the young girls, but also the boys are affected, and this project had to be extended to work with SHAM and to work with young boys. And here also we got a picture with ATS. It's in one of youth organization, and you can say we also made calls to remind you of your appointment, and it's very important to increase of this visit for these teenagers. No such. They are the result for the fiscal year, June 2020, June 2021, number of tests, 32,348 young girls and women were tested. 94% of the total of these new cases they started on TAV and are also included in the treatment. And 91, those drop-offs and the new ones, they returned to this treatment and this care. The challenge, as we know, all of us, the pandemic-19 limited the activity and our community activities. So some of the integration visit of those drop-offs we stopped everything, only slowly we starting now to visit, but at the end of last year, there's not a lot of help, a lot of support to these teenagers to go and pick them. We had a problem with our night brigades, meetings in clubs. All those activities were helping not only to go and pick them up or interact with youth, but we had everything limited. Another challenge, the primary test for men less than 25 years, and the problem of this young group that visit the search. So these are the less than 25 years. The partnership with QAM and UNICEF, it's giving a big result, which is very interesting, and we also, but the other challenge is to collect, make sure that all the young girls are tested, and those who are pregnant, who are under treatment, also can eliminate the transmission. So this is the biggest challenge that we need to continue to have a solution. The other challenge, it was a lack of telephone and false addresses. So that it was difficult to keep in touch with these teenagers. Good practice and the use of this mechanism for these activities is an incentive that for those who drop off for these health centers, the use of the system to collect data, which is digital, through Collab, which improves the quality of the verification of the data, which are very important to secure that the service, good service are there, and the quality that must be given, and also use of message for the following activities. This is also not a good practice, and use of attend to implementation, counseling with privacy in the community where the activities they are. This activity gives a good result because you can see an increase in the number of teenagers that go there to be tested more than at such. Thank you very much. I'll be available for any question. Thank you.
Muito obrigada, doutora Mirei. Eu acho que agora passamos para a sessão de perguntas e respostas.
Thank you very much, Dr. Mirei. Now I think we're going to go to Q&A section. So those who have received the answers, I think the first question for Dr. Maria Grace, I would like to know that the mobile brigade, is it available for those who are not, or they can also move from one place to another? No, I'm not sure if Dr. Maria Gata would like to start answering now. Thank you very much for the questions. Truly speaking, we don't have any mobile analysis, but this is one of the strategic that is been involved with the Ministry of Health and in the national strategy at the moment. So in all those provinces where the criteria are on place so that we can have a mobile brigade so that we can try to have other population as a target for those who are cannot afford to go or have difficulty in mobile. So it is a strategy that we can still think of implementing. Thank you. Thank you very much, Dr. Maria. Another question for you. It's also linked to Cabo Delgado. Difficulties that we have, they are played. Did you try to include military posts in this program? Yes, yes. It's in fact there are some districts which have been affected by this military conflict. So we're working in partnership with some health centers, which are military health centers, and it will be so we cannot explain all the activities to make. It will be long history, but who had a question, who will pose the question can also contact me so that I can be able to explain to him because it's a long answer to give. Thank you, Dr. Ma. Dr. Giselle, I would like to know if all the women that they drop off, are they on a rural or urban areas?
Pode ser agora?
Pode, doutora.
Obrigada, obrigada.
Can I answer now? Yeah, usually after the drop-off, there are the women who have a level of menstruation for the need of TARVO, even if they look healthy. And the women that they don't have any family structure that can give them support to minimize the stigma or family support to prevent the drop-off. That's what I can answer now. But I think Dr. Maria can help me to explain more. But I think women with more expression, they got more sense of this, the consequence, they know what this transmission is. So here, there's a need to follow the TARF so they can be healthy in a way that for them, husband and father. Doesn't matter if it's in a rural or urban area, but obviously in urban area is where we have women with a set of knowledge. Another question. First of all, to thank the association for this extraordinary work. I would like to ask, what are the behavior that we still notice in this teenager, and what did they recommend so they can reduce to overcome? What are the youth need so that they cannot be infected? Thank you, Sparali.
Sim. Muito obrigada.
Thank you.
O que precisam os jovens?
What the youth need
Se prevenir ou
to prevent or to reduce? What they must have more information of all the health services, health centers, that, and there must be more activities. Like I would say, they have more debates within the communities and films, message, and have more deep debate with amongst youth and to talk about all the themes so that all the youth can be also involved, and also have those sections to visit the community. We've got musical group to make a call so that we can organize any debate which is open for everybody so that they can be involved. Thank you very much, Arina, for your contribution. Agora, we're going to go to the final conclusion. First of all, to thank all the participants for all your contribution, your participation in this section. We know it's a year that's full of a lot of work. We're all busy. Thank you very much, all the participants, and we hope that this section, it was useful for everybody. And we hope that this information has been shared and discussed during this session. It will help for your personal and professional way, and also to thank you for the stigma on the youth in Mozambique. And to thank all the participants that raised their questions during this section, and to encourage to participate so that to share your record with your colleagues that they couldn't make it to this meeting. Everything will be available in this platform, your AS for the personnel, which will be free of charge. And you can also put online, you can view on anytime from next week. But before I close, please, once again, fill the inquiry, which will be projected so that we can give the IS so that we can improve in the future meetings. So we have to stop here, and thank you. And be safe. Now we're gonna pause the survey for your answers.
Ok, então, muito obrigada. Esperemos vocês possam continuar.
Thank you very much. We hope you can still continue on a fourth section, which will talk on activism on FEB and then a poll, lessons and results and a pandemic. Please be connected and be on this platform for the last platform, for the fourth one of the day. Thank you very much and enjoy the rest of the proceedings. Thank you.